My name is Ashley McNeal, and I will be presenting my PowerPoint on the MSN Population Health Project. My population of interest is older adults with chronic diseases. This population is important because by 2050 it is anticipated that Americans aged 65 or older will number nearly 89 million people, or more than double the number of older adults in the U.S. in 2010. Between 60 and 75% of older adults have multiple chronic conditions, and these account for two-thirds of all healthcare costs and 93% of Medicare spending, yet less than 1% of U.S. healthcare dollars is spent on prevention. The CDC states the older adults are 5 times more likely to be hospitalized and 90 times more likely to die than 18 to 29-year-old people with COVID-19. Chronic health conditions increase the risk of hospitalization and death, with the risk rising with each pre-existing condition. These are the 5 sub-roles of the APHN. Healthy People 2020 and 2030. The goal for older adults for 2030 was to improve health and well-being, and this was done by increasing physical activity, reducing falls, reducing inappropriate medications, decreasing hospitalization for preventable causes, and dementia. APHNs in 2020 were tasked with developing programs that encourage social support for physical activity, including promotional ads, flyers, social media, increasing access to facilities, signs promoting the use of stairs, competitions, community-wide events, etc. In 2020, they had a 10% reduction in the proportion of older adults with moderate to severe functional limitations. For my literature review, I looked at 3 different research articles. I searched for them using EBSCO, CINHAL, and Elsevier databases, limited to the last 5 years. According to the CDC, an estimated 41% of U.S. adults reported avoiding medical care because of concerns about COVID, including 12% who avoided urgent emergency care and 32% who avoided routine care. According to the U.S. Census Bureau, 68% of those 65 and older report difficulty with independent living. Internet access in this population is increasing, but 41% do not use the internet at all, and 23% still do not use cell phones. Cognitive impairment was reported by 38.8%, and all of these factors contribute to severe disease in patients that contract COVID-19. These are the 3 scholarly articles that I looked at for research. And according to the Joanna Briggs appraisal tool, all 3 of the articles were relevant and reliable. For primary prevention for COVID-19 includes avoiding exposure and just the basic COVID-19 precautions: remaining 6 feet apart, wearing a mask, frequent hand washing and sanitizing, avoiding touching the face, cleaning and disinfecting surfaces, monitoring for symptoms, and obtaining vaccinations. Continuing medications and keeping a 30-day supply is very important for the older adult population. Telehealth visits with healthcare providers are important, and because they don't want to go into the office, and they put off seeking care because of that. Seeking medical treatment when needed to avoid exacerbations of chronic conditions and secondary deaths as a result of people attempting to avoid COVID-19. For secondary prevention, monitoring for symptoms, identifying infection early, contact with primary care providers, and within 24 hours of noticing any symptoms, self-quarantining for exposure to someone with COVID-19 in the last 10 to 14 days. And then tertiary prevention for mild symptoms is to self-quarantine and treat the symptoms, staying home away from others, hydration, Tylenol, rest, cleaning and disinfecting, hand washing, monitoring for worsening symptoms, and staying in touch with the doctor. The best ways for an APHN to assist this population are recognizing the need for special attention that needs to be given to the older adult population, especially those with chronic disease, as was evident in the studies evaluated. These are the different ways that an APHN can use the sub-roles to intervene with this population. Florence Nightingale is still very relevant in this environment because she believed the environmental conditions contributing to health and well-being of patients, including pure air, light, cleanliness, effective drainage, and pure water. The needs assessment for this population are education, telehealth, management of chronic diseases, vaccination, sanitation, social distancing, and understanding risks and prevention measures. The priority education plan was to increase understanding of how COVID-19 spreads, increase primary care use, management of chronic conditions, increase compliance with masks and hand sanitation, and decrease COVID-19 deaths among older adults. We can educate this population through telehealth, home health flyers, television ads, and community posters. My MSN project was to identify patients at RMC that were older than 65 who were discharging with a chronic condition. I provided verbal and written education for this population with a brochure on COVID-19 education. And then I made follow-up phone calls a week or so after discharge to reinforce the education and to evaluate their retention. This is some guidelines that I used to develop the handout that was given. Anniston, Alabama. This is some information about Anniston, the location that the education was provided. This is more about the history of Anniston. PCBs were a big significant trend for Anniston. They were found to have detriments to blood pressure, diabetes, hypertension, thyroid disorders, metabolic disorders, immune system effects, cardiovascular disease, hyperlipidemia, neurocognitive effects in children, and some cancers. This is the local government structure of Anniston. Key leaders for COVID-19 in Anniston. U.S. Congress representation, state representation, and party affiliation. The health policies, American Public Health Association was established to advocate for the public to key decision makers to keep them informed of community needs when making decisions on public policies. Nurses can improve health for older adults by increasing physical activity to promote, advocate, and reduce health disparities for this population, according to the ANA Code of Ethics. This is about being an advocate for health policy, including education for physical activity and advocating with community leaders on access to these facilities. This is the population size and density of Anniston, estimated at 21,287 in 2019 per the U.S. Census Bureau. Education levels and the unemployment rate for Anniston. The current unemployment rate as of August 2020 was 10.6% in Anniston, when the national rate is 7.7%. This is the racial and ethnic diversity in Anniston compared to the diversity in the U.S. These are the top occupations. Per capita income, the poverty level, incomes below poverty level in Anniston is 29.1% compared to 10.5% nationally. These are the incidence and prevalence of 5 most common major chronic diseases and rates. They're pretty comparable to the national. This is more vital statistics, infant mortality, and births to mothers younger than 20. The 5 most common reportable communicable diseases was as of 2017. I'm sure these will be different when we get the total COVID-19 figures. The crime and violence statistics were significant. Anniston had a daily crime rate of 29.72 per 100,000 people population, and nationally that number is 7.07. Disadvantage is very apparent in the west side of Anniston. It's more densely populated with Black residents and poverty. There's inequality and many issues that need to be addressed to reduce the poor outcomes for the people in Anniston. And there's some suggestions for how to do that. This is a key leader informant interview with Lindsay Laminack, the supervisor for the infection prevention and control team for the ADPH. And this was an interview with a Anniston resident, a retired veteran with high blood pressure, and his views on COVID-19. This is a summary. After doing those interviews, it was pretty evident that COVID-19 had a high impact on older adults, and more interventions need to be focused on this population in order to improve outcomes. This is my 3 community diagnoses. The priority community diagnosis is the risk is high for older adults with chronic diseases in Anniston, Alabama to have complications or death from COVID-19. Mass flu vaccinations and mass COVID-19 vaccinations are a great community action plan, including education, prevention of COVID-19 infection, chronic condition management, primary care utilization, and community resource utilization. The overarching educational goal is to decrease the risk of infection and complications in older adults by increasing knowledge. These are the objectives of the project. This was an outline of the project that I already talked about. Some barriers to the education provided were unreceptiveness to teaching, since the patients were in an environment where they still weren't feeling well. They were about to be discharged, but there's lots of beeping going on, the monitors, there's all kinds of people coming in and out of the rooms, the TVs are on, there's lots of distractions. Also, literacy levels. I had a few patients who were not able to read the pamphlet, so they weren't able to go back and look at the brochure after the teaching was provided. They were overwhelmed with information at discharge. They're being given lots of information about managing their chronic condition, and then also this information about COVID. So when I spoke to them on their follow-up phone calls, there wasn't a whole lot of retention that I found. Most of the patients weren't able to tell me much about what they'd learned. But at the follow-up phone call, I was able to provide reinforcement of the education, and hopefully the retention at that time was a little better, since they were feeling better and they were at home in their own environment. There were 2 people that I could not contact for follow-up, just not answering the phone. A lot of people don't answer a number they don't recognize. The Progressive Care Unit, or RMC, cooperated to help me identify patients who qualified for the project. Candy Williams is the manager of PCU at RMC, and the staff nurses on PCU and the patients and caregivers participated to make up the team members for this project. The key stakeholders for this project were RMC, Candy Williams, myself, staff nurses on PCU, patients and caregivers that participated, and the older adults with chronic diseases. These are the references that I used. Thank you.